In a heart problem, you will have, somebody has kept a heavy load on your heart. You will experience the most excruciating pain of your life.
That the actual
That
blockage pain.
Actual blockage pain. After COVID, there is a lifestyle change. The kids earlier they used to be studying in the school. Now most kids have a tab or they have a laptop. They are studying
Online
like that.
classes.
Online classes are there. Earlier there was no online class. Now they are confined to their room. They are confined to the laptop and doing some studying there.
Heart health, complete core heart health. So, what are the tips you will give people that these are something that basic things they can do to make sure their heart is good?
First thing is that sugar is the killer. Second is avoid salt.
Salt.
Reduce. Whatever thing you whatever packaged items, chips loaded with salt. You stick to your basic oils. Mustard, coconut, ghee, they are good enough.
Ghee is good.
Yes, it's not bad at all. Increase some fiber content. Your green veggies and all in your diet. This junk food is not at all bad also. Many countries they are staple diet.
Yes, and they're perfectly fine.
They're perfectly fine.
Yes.
So we cannot say that it's bad.
Hello everyone, welcome to OrissaPOST Live. Another episode where we have a podcast, we have an interview, or what I like to call a conversation. And today's conversation is more health oriented, more towards our heart, more towards our lungs, more towards the fact that why there are so young kids out there, even influencers, having heart attacks, gym goers, celebrities with proper dietitians and proper schedule, they are having heart attacks. What's actually happening? So we have today with us a cardiothoracic surgery and vascular care specialist, Dr. Biswajeet Mohapatra. And let's welcome him without any further more saying, because I believe this conversation is going to be a very mind-boggling and a very fact-based conversation. So let's welcome our doctor. Hello, sir. Welcome to our show. It's lovely having you, doctor. And can you just say me what is this cardiothoracic surgery and vascular care? This name is very new to me. Can you just say me what is this?
Yeah, first I'll say that I'm more than happy to explain it to you because
Thank you.
Most people don't know about it. It's a complex surgery. It's a complex surgical branch. I'll say. I mean, the cardiothoracic surgery that deals with the heart, with the lungs, like the thorax, and basically this our chest. Plus vascular part is there that deals with the surgery of the blood vessels. So this cardiothoracic and vascular surgery branch, this deals with the surgery of the heart, the lungs, and the blood vessels. Okay. I mean, as because this is a complicated surgical branch. That's why most people usually don't come across it. Every now and then you will have a fracture of any of the leg. Now and then you can have somebody is pregnant in your house. So you go to a gynecologist, you go to an orthopedician, you have a gallbladder surgery, so you go to a general surgeon.
True.
But heart diseases are obviously the numbers are rising, but the overall number, if you see that they are less in number as compared to the other surgeries. That's why it is not very many people don't properly know about this. So that's why I'm more than happy to explain it to you that what it deals with. So basically, cardiothoracic and vascular surgery, they deal with the surgery of the heart, that is otherwise called as open heart surgery.
Okay. Now you said not many people know about this.
Yeah.
Now, if you go back to your career graph, why did you choose this? Like, what inspired you to take this? If many people, that's something people really want to know.
That's the catch.
That's the catch.
So, when in the 90s when we were in high school, that time obviously cardiothoracic surgery started in India long back in 1970s.
Sure.
But 90s are the time when cardiothoracic surgery was picking up everywhere in India. I mean, it was rising to its pinnacle in the 90s. So then many new surgeries like beating heart surgery, must have heard the name beating heart surgery.
What is that basically? Actually,
the heart is will continue to beat. Heart will continue to beat, and alongside we will be operating on the heart.
oh my God.
So that was introduced in 90s. 95, 96 that time. So that's why I used to, as a student, as a student in the high school, I used to see all those things I used to follow that also. I had an interest in that, so I used to follow that in some scientific magazines or some news, so from that time only I decided that if I become a doctor, I will become a cardiac surgeon only.
Oh my God. So you're the one
Nothing
who
less, nothing more. Cardiac surgeon
beautifully
only.
said. Beautifully said. Now, when I was doing research on you, when we were looking for like doing some work on this, we came across another word that is minimally invasive cardiac surgery. Now, what is minimally invasive cardiac surgery, and is it different from open heart surgery? What is it basically?
Yes, yes. Minimal invasive cardiac surgery is my specialty,
Oh,
particularly.
that's why it popped up so many times when we were doing
Yes,
research.
yes. Because in a open heart surgery, what we technically do is we open the chest and we reach the heart, and we fix the problem of the heart with some intricate surgical steps. But with minimal invasive cardiac surgery, earlier it used to be open cholecystectomy. There used to be surgery of the gallbladder surgery. They used to do it in a open, in a proper surgical way. You have to have a big cut in the tummy, and you take out the gallbladder. You have a appendix, you get a big cut in the tummy, and you get out the appendix. So similarly, but later on, laparoscopy came. So that you have only small holes in your stomach, and you take out the gallbladder, and you take out the appendix, diseased appendix and all. So this is a similar kind of thing that is called a minimal invasive surgery. Means you don't have to have a big scar or a big cut on the body. You will do the surgery with a very small incision on the side of the heart, on the side of the chest, like this, like here or like here, and you do the surgery through that
Small
small
chest,
incision.
small hole.
Obviously, you will have help of the telescope and all will be there, and you will do the surgery through that.
That's
So that is called as minimal invasive cardiac surgery. Minimal invasive, why? Because the incision is very small. That's why it is called minimal invasive.
so. Is this minimal invasive surgery is becoming a standard protocol, or it's only for selected cases?
No. You can do most of the cardiac surgeries through minimal invasive technique only. Rightly, we are doing in our hospital, our center, we are doing most of the cardiac surgeries with minimal invasive technique only. Yes, a few complex, few complicated cases, those cases we have to do in an open way. But standard straightforward cases, we can go ahead with minimal invasive cardiac surgery with a very small incision and all.
Now, needless to say, you have no. It's not needed to say over here that you have done multiple surgeries already by now. So
Thousands.
thousands. My God, the number is in K. Thousands. So, what are the age age scale of patients? Because people think when issue of heart disease or these kind of thing comes along, people think it's basically from older section of the people. But
Yeah.
is it only old people?
No. It's not like that. Heart disease, all age groups have their own set of diseases.
Because kids are nowadays
Yes,
getting
kids.
hit by this.
See, technically, if you say kids, children are usually having, they usually have the congenital heart disease. Like you must have heard some hole in the heart. Some baby is having a ASD, there is a hole in the heart, a VSD, the ventricular septal defect, or a PDA, that is a patent ductus arteriosus, or a blue baby, like that is a tetralogy of Fallot. So those blue babies, is a pediatric age group problem. So those cases, they come in the pediatric age group, and we tackle them with surgery, that pediatric cardiac surgery. So we do all kind of surgeries at our center. We do pediatric surgery. We have ASD closure, VSD closure, and this PDA ligation, the patent ductus arteriosus, and the blue baby surgeries also, like the tetralogy of Fallot, intracardiac repair, and plus other some complex pediatric surgeries are also there. So these goes in the pediatric age group, and the second is the young adults or adults. In that, many people come with valve diseases. Our heart has 4 valves. So out of that 4, usually 2 or 3 gets mostly affected with rheumatic heart disease. In our part of world, rheumatic heart disease is the most common heart disease in our part of the world. So we get many heart patients who are in their 20s, in their 30s or 40s, and we get operated. We operate on those cases and do the valve replacement or repair depending upon the disease. Plus some nowadays some elderly age group also coming, that is 60s or 70s. We do either the patient is having heart valve diseases, which are not repaired in the younger age group, and they were managed medically with medical management, with some medicines they managed, and we operate on them. So that is in elderly age group. Plus, if you come to coronary artery disease, the heart attack, what we the commonly people perceive as a heart attack.
Yes.
Heart attack, is a disease of the coronary arteries of the heart. They are the blood vessels of the heart. So it's a blockage in the blood vessels of the heart. So that is what we used to think that only elderly age group above 60 years age group will have those coronary artery diseases, and in those cases we will do stenting or bypass or something like that. But these days, the age group has come down.
Why
That's
so? Like,
more and more people in their 40s or late 40s or 50s are also getting affected with coronary artery disease. So basically 3 groups. One is pediatric age group. We do, the congenital heart diseases. We operate on them. And second is the adults or young adults. We basically have valve diseases, and we manage them surgically. And the third group is the elderly age group. Obviously, age has come down, as I said. We manage those people are having mostly coronary artery disease, and we manage it surgically, either with stenting or bypass or something like that.
so now that we're talking about the blockage in the arteries,
Yeah.
which is linked to heart, my question is, how will a person know what are the symptoms that we can see, irrespective of age? Actually, what symptoms we can see that there is a blockage in the flow?
So, obviously there is, whenever you have a block in the coronary arteries, arteries of the heart, obviously we have some warning signs.
The warning signs.
We should never ignore the warning signs. The warning signs is that you experience some chest discomfort. Chest discomfort. Most people, negate it, thinking that it is a acidity or some having some gas problem or something like that. So basically, what I want to emphasize is that we should not ignore those warning signs.
How
Because
to know
the
the
warning,
difference?
yes, difference obviously. In a heart problem, you will have pain in the middle of the heart, and that is kind of a as if somebody has kept a heavy load on your heart. It's like a squeezing type of pain. Somebody is squeezing your, somebody is pressing upon your chest like anything, and you will experience the most excruciating pain of your life.
That the actual
That
blockage pain.
actual blockage pain. Okay. Usually it is after doing some exercise. In the beginning, usually it is after some exercise, like suppose you are working on uphill course, somewhere you are working, you can experience that. Suppose you are climbing stairs, 2-3 steps of stairs, 2-3 flights of stairs, and you get some chest discomfort. Sometimes it is associated also with sweating. Sometimes it is associated with that pain, that is radiating to your jaws, that these jaws, lower jaw, particularly this area.
This one.
Yes, this lower jaw.
Okay.
Okay.
So,
And
what happens actually? It
and
hurts.
You get it hurts. Similar pain. The pain you are you are experiencing here, you can feel the same kind of pain in the
Over
jaw.
here?
Yes.
And why so?
Tightness. And in the neck, in the shoulder, in the hand. This is because the radiation. This is called a radiation of pain. Radiation of pain means these areas are supplied by a similar group of nerves.
Okay.
They are supplied by similar group of nerves. They take the how you get you sense a pain. You sense a pain because you get a pain somewhere, and that sensation is carried by a nerve to your brain. So whenever you get some heart problem, you get all these nerves, these areas, they are all linked. These, so that's why you get pain in the chest. That can go to the neck, that can go to the lower jaw, that can go to the shoulder, that can go to this part of the hand. So if you are getting this kind of pain, you must be alerted.
Okay.
And you must visit the doctor, take a proper medical care. Don't ignore it, this kind of pain. Acidity pain, acidity pain is usually localized to the upper abdomen. This part.
This part.
Upper abdomen. It's not in the chest. It's in the upper abdomen.
Okay.
This part.
There's a difference. Good difference.
Yes. There's a difference.
Big difference.
Big difference is there. And usually it is if you have empty stomach for a long time, you have not taken any food for a long time, those kind, or if you have taken some spicy food or something like that, then you may get this kind of pain, that acidity pain. And that usually you get relieved after you take some antacids and something like that, and you get relieved. And that pain is localized to that area only. It will never go to these areas. So if you are having pain in chest, that is radiating to the jaw, neck, hand, and all, and particularly after doing some exercise or having a heavy meal, then you must see a cardiologist. You must see a doctor as soon as possible.
But now there's one more point that you said: sweating.
Yes.
How can differentiate this a normal sweating or?
It's not a normal sweating. Many times people are having some it's a hot humid weather, or you are having some panic attack or something like that. You may get some palpitation, fasting bounding pulse, and some sweating or something like that. But that is a different scenario. This particularly along with chest pain, if you are getting this kind of sweating and this tightness in the chest, as if you are having a heavy load in the chest, somebody is squeezing you, that kind of pain. Okay.
These pains and associated with the sweating. Then it is not a normal sweating.
Yes, it's not a normal sweating.
See, that's something one should keep, be aware of. But then again, another thing that is coming up in my mind is that apart from chest pain, let's say I even heard somewhere that a person getting having a heart attack without the chest pain. Is it possible?
Yes, it's possible. Many times these days our country is the diabetes capital of the world.
Yes.
So if you are having high levels of blood sugar, many times this kind of pain, as I told you, because these pain sensation is carried by nerves. So these nerves are damaged by high levels of blood sugar.
Oh.
So if you are having high levels of blood sugar, many times you may not be having pain. This pain you may not feel. Okay. So those cases are in somebody who is overtly diabetic, uncontrolled blood sugar. So in those cases, you will have pain, and that is, you will not be able to sense that pain. So that's why that is sometimes we call it a silent heart attack.
Yeah.
Now those kind of patients usually they present with, breathlessness. Breathlessness means sometimes you take you walk and you will feel like short of breath. That you are having some problem with breathing. So obviously you will be able to know it. So these highly diabetic, some person is highly diabetic, they present like that.
Now this is how to know a person is having heart attack. Now let's say there is a person in front of us and that person is having a heart attack. What should the bystander do? Like a person standing right next to them.
Yeah.
What should be the first 5-minute response?
See, technically the best thing you can do is as soon as possible you can take them to a proper healthcare setup. That's the first thing you can do. I mean, many centers are there in most of the places, particularly in India, either having a clinic or having a anything will be there. Any healthcare setup must be there. You can take them to that, and sometimes it is advocated that you can have uh, some uh, some tablets like the primary response tablets like
Aspirin.
aspirin.
Ah.
That Disprin tablet is available everywhere. You can take that, and atorvastatin, that is the lipid, that is the cholesterol lowering tablet, that is also available, and plus some nitroglycerin tablets are also available. That is for for chest pain. Many people take that also. So these kind of tablets you can take, but basically you need to rush to a healthcare setup.
Now, this has been the part where we talk about
Because one thing I also want to clarify that
Sure.
if you are having heart attack or severe chest pain or something like that, there is a golden period of time, golden time. The
Okay.
golden hours are there. The initial 6 hours are golden hours.
initial 6 hours.
Initial 6 hours. So if you reach a proper healthcare setup within that 6 hours of time, there is every possibility that your normal cardiac function will be restored by the treatment. Okay, because we can suppose there is a blockage in the artery, we can immediately we can dissolve that blockage by medicines are there. We can dissolve that. But if someone is reaching after 6 hours, 8 hours, 10 hours, then it's difficult to treat that. Yes, we can treat it, no doubt, but that 100% treatment may not be possible. So basically, if you are having these kind of symptoms, urgently reach a healthcare setup within your golden hours time.
Golden hours, that is 6 hours. But now, this 6 hours begin from which point? Like
When
a
you are having
person,
chest pain.
the symptoms that you said,
Yes.
the chest pain, jaw stiffness,
Yes.
and those. From that point to 6 hours, that is the beginning of the time.
Yes.
Okay, now you need to remember that. See, as our doctor said over here, that when those kind of stiffness happens, that's when the clock has started ticking. 6 hours left. My God, that is scary and also very important for us to remember. But now there are people who are fitness freak. They're going to gym and everything, but we see them having a heart attack while working out. Great physique, proper lifestyle, everything. They're like influencers. Recently, influencer also just had a heart attack in Rajasthan.
Yes.
And this kind of, and why do these people are having heart attacks? Even celebrities.
Someone looking fit from outside may not be fit from inside. Fitness means as a socially how we see the things. Fitness means lean body, slim body, good muscular physique, those kind of things. We perceive fitness socially.
Yes.
So, but thing is that the person may be stressed. We don't know. The person may be overstressed actually. In pursuance of this fitness, he may be stressed. Okay, he might be having, or he or she might be having high cholesterol. We don't know it. We don't test it. He or she might be a smoker. We don't know it. Might be some other kind of stress in life. We don't know it. Or some other form of some cardiac diseases are also there, like those affects usually young adults, muscular young men, while they are playing or while they are doing some gym or activities. There is it's called as hypertrophic cardiomyopathy. And here I also want to emphasize that we are the only center in Orissa who have done most of the hypertrophic cardiomyopathy surgeries in entire eastern India.
Okay.
So hypertrophic cardiomyopathy is a disease that usually affects young adults in 20s or 30s or something like that, where there is a sudden cardiac death. It causes sudden cardiac death, and it's usually familial. This disease is usually familial. So one thing we can do is, many also cardiologists we also advise the people, the gym freaks and all, get yourself checked first. Then do proper, you can do cardio. You can do cardio exercise. But if you are doing professional kind of exercise like, heavy weightlifting, heavy exercise like that, muscle building exercises, then you must get yourself checked first. Don't skip that health checkup.
Health checkup is
Yes,
important.
proper checkup before starting all those activities.
And what do these checkups involve actually? What
Involve
kind of
usually,
checkups?
they usually include basic tests like ECG, treadmill test, and plus echo, and your blood sugar, your blood parameters like your blood sugar, your cholesterol, those kind of things. Okay, so that we can detect if at all there is any structural disease present beforehand.
Now, this is a question for a specific age group. I'm talking about this 25, 30, 40, this
Yeah.
people. So, what should be the checkpoints, like time frames of this time to this time there should be a checkup, and why they should take it? You said given one reason why they should take it seriously, because it can happen anytime. We might even not know that
Yeah.
you're living a healthy life, and the very next moment heart attack is knocking on your doors. But what should be the proper timeline? This time to this time, this time to this time. What should be a proper timeline
If
for
you
that?
are, in basically how we suggest is that if you are above 40, get yourself checked at least once in a year.
Once a year.
Yeah. And if you are below that age group, you are in the 25, 30, those kind of age group, you can get yourself checked once in a while. Then you do your activity, lead your normal life. If you have no diseases, you can 2-3 years you can have a basic checkup. Sometimes these young people are also having diabetes.
Yes.
And yes, and these days this kind of diabetes is also very common. This 25, 30 years old, boys, 30-year-old girls, they are having diabetes. I mean, diabetes in the sense of, high blood sugar in the tune of 250, 300, those kind of blood sugar levels. That is
How,
having.
like, yes.
It is because of, this kind of stress. Basically, I will blame it on stress.
Stress is the main killer.
Yes, stress plus high levels of refined sugar intake.
Okay.
Refined sugar means all the packaged foods, late hours of sleeplessness. You stay awake for late hours.
Yes, yes. Sleep is important
You
aspect.
stay awake for late hours.
Mm-hmm.
So those things, they affect you. They affect obviously they affect your mind. They can give you some gain in your career, but they affect your body like hell.
My God.
So that can lead to high blood sugar levels. Excess, stress hormones are released, and your blood, all the cholesterol and your sugar levels will always remain high. So,
I mean, what is the point of having a career when you won't be there to enjoy
yes,
it?
that's
Isn't it?
So you
scary.
must address stress.
Yeah.
You must address stress, and this staying awake for long hours and thinking that I have achieved this, I will achieve that, but nothing.
You won't be
you're
there
not
to
going to
achieve it.
gain anything if you don't have your proper health.
Yeah. Now, as long as we're talking about the sleep aspect,
Yeah.
can you share some more light what a proper sleep should be, and what happens with a person who doesn't take sleep, doesn't take sleep seriously?
See, when you are sleeping, when we sleep, say 9 or 10 p.m.
Yeah, around that time.
and we wake up at say 6 a.m.
Yeah, that's a healthy
So
one. I guess.
that's a healthy 8 hours of sleep.
Oh yes.
That every person needs. Your body needs rest. Your body needs rest. When you are having, when you are taking some food, in your body insulin is released from the pancreas, and that metabolizes the sugar. And other organs also, they also increase they release their enzymes and all, and they metabolize the sugar, they metabolize the food basically that we take. But if you are staying awake, you are not taking during that sleep time, these organs also take rest. So basically this is a biological clock in the body. It's a biological clock in the body that this much time we will stay awake, this much time you will sleep.
Okay.
The body, you are awake, but internal organs are in rest. So basically, if we disturb those resting time of those internal organs, they'll be obviously disturbed. Their functioning will be disturbed.
They'll be
So if
overturned.
we disturb, they'll have to wake up in the middle of the night and in the middle of their sleep, and they will have to produce insulin. They will have to produce some XYZ enzymes and all. And obviously, they'll be next morning. They'll be not properly functioning, and you will be having.
There was no
you know,
rest
you will
time.
have reduced insulin levels in your body, and you will have high blood sugars. So that's how it is related. If you don't give your body proper rest, obviously next morning you will not be, you will not be feeling well.
So now we talked about sleep and these things, and I'll go back one step back where we talked about checkups. Is there any when the I believe this, it's a personal belief that many people fear checkup because the monetary aspect, it will be very costly. And those, is there any cheap or not cheap and a very financially suitable way of
Yes,
approaching this?
you can have only few checkups, only very few checkups, few tests. Basically, you can have a basic blood test like this blood hemoglobin and TLC count, that is also called as complete blood count. That is a very cheap one. You can have your blood sugar level, fasting blood sugar, and postprandial if you have high blood sugar. HbA1c, that shows your 3 months blood sugar levels, and plus you can have your blood cholesterol, that is the lipid profile. So these are some basic tests. With these basic tests, you can your just urine routine test. So these basic tests, they can detect most of the ailments. Okay, so these are not at all costly. They are very cheap.
Good. People should know about this actually. Don't let your fear take the better of
You
you.
don't need to do some 2,000, 5,000 rupees tests. The entire thing I told you will come in 500 rupees.
See that 500 rupees once a year or
Many
something.
test centers are there. You can drop into any test center and get it done.
Yeah, fitness comes first.
Even in government setup also you can get it done for free.
Yeah, for free. Yes. Now, we'll go back to the surgery part. This minimally invasive heart surgery that you specialize in. So, what distinguishes this from the traditional procedure? You already said that. That what the mainly the scar, not this kind of thing. Like lot of cutting is not there.
It's not only the scar. See, you see someone with a big scar.
Yes. I have seen one or two people.
If you see someone with a big scar, person may be hiding it. Here you don't have to hide it because
Just
it's
one dot.
already it is hidden.
It's already
That
hidden. Yeah.
small incision is already hidden. So basically, it's a blessing for ladies, for a person who is having. Suppose you are a
Model.
you are a. I mean, one of my patients is he's a gym freak.
Okay.
He's a fitness freak. He is always into the gym, and we have done his surgery over here. So he's a muscular man, and we have done surgery only here. You will not be even able to know it. And in ladies, it is absolutely hidden.
Oh.
So you don't know it. That is one thing. Second thing is that because this minimal invasive surgery, that only small incision is there. It is next is the post-operative pain. After surgery, obviously, if you are having big scar, you will have some more pain. But if you are having a small one, obviously your pain will be very less. This much only, very less pain. So plus you don't need to have a lot of antibiotics for your wound to heal. You will have very few antibiotics. You will have only very few medicines. Plus very few days of hospital stay, only 2-3 days of hospital stay, and that's it. You are home, and you don't need to have to wait for 2 or 3 months to get back into your work. You have only a small incision, a small scar, that heals by 1 week or so.
So how fast they can go back to normal life?
Within 15 days, you can go back to your normal life, normal office work.
So this might be bad news for the people who are thinking of taking a long vacation from office using this. 15 days, man, you're going back. But anyway, no jokes on this one anymore.
That you can write, you take rest for 30 days.
30 days. Then you can give them a like an exclusion. Come on, man, it's fine. You can take your leaves. But anyway, but the healing period is shorter in this.
Yes, healing period is shorter. Plus, you have to, obviously, if the healing period is shorter, your productivity is more. You are more, earlier you were into your work.
As long as it doesn't heal the scare, the constant state of
yes.
fear, that is less.
See, whenever someone is detected with a heart disease that requires open heart surgery, basically, people are, dead scared because, you have to, I'll have a
Cut open my body while I'm still alive.
In my chest.
Yes.
It's a very dangerous, very scary kind of thing. But if it is a very small one, then you don't need to be scared of it. Whatever surgery you need to be done, you can get it done with a very small incident. That's it.
And now, you don't only specialize in heart. There is lungs also, which you are specializing on. Now, yes.
Very few centers in our state particularly, they are doing proper lung surgeries. Many cases, many unusual cases also have done in the lung surgery, that group. So it's a specialty that deals with the diseases of the lungs, our respiratory system.
Yeah.
So and lot of diseases are there. Still now, tuberculosis is present.
Yeah,
it's all around us, and it can cause a hell lot of diseases of the lungs.
My God, tuberculosis itself brings a lot of disease with it.
Yes.
Wow.
It itself, it can cause a lot of problems with the lungs, and that we deal with those kind of things. Many other diseases are also there. Some lung tumors are there. Some other intrathoracic tumors are there. So we deal with all those kind of things.
So I don't know where it's coming from. Basically, we might get it. It's coming from a very layman perspective, because I'm bringing this question from a person who is not medically knowledgeable, but a public, asking you, what kind of changes did people have after taking the COVID vaccine in their lungs or in the body? Did it had some profound, because news were coming up?
Yes. The news is, see, I'm basically not really an expert about this, but
is there any kind of that you see in your patients, something like that? Some long-term patients, you have seen some difference. I'm not talking about the COVID vaccine, but did the COVID leave an impact in?
No. First thing is that, yes, COVID has left some impact in the, it can cause lung fibrosis. It can cause some lung damage that is permanent.
Permanent?
Yes.
My God.
It has caused. Already some people are like that. They depend on oxygen. They depend on, they cannot take a brisk walk because of, lung compliance is less. But if we blame everything on COVID, then it's not good. It's not true.
Okay.
Or if we blame everything on COVID vaccine, then also we are not correct. Yes, there are speculations that COVID vaccine or COVID itself, they have caused some, they have, after that there is increased, lungs and heart diseases.
Yes, that was the news actually.
But maybe it's in the other way that, after COVID, if you see, your lifestyle has become more sedentary after COVID.
Yes.
After COVID only we got to know that you can work from home.
And the term was not there before.
It was not there before.
No, it was new thing.
After COVID only we got to know that yes, you can work from home.
Oh, yes.
You can work from the comfort of your home. You can sit on a couch and you can do laptop work all day, all night.
Yeah.
Obviously it is going to affect your heart.
Oh.
If you sit in a couch and do your laptop work all day, all night, obviously it's going to affect your heart.
Yes.
So no activities, no physical activity, no exercise, nothing, and you obviously are going to get some heart problem.
My God. Exercise is so much needed, right?
Yes, it is required.
No, when we say exercise,
it is required because you need to go out to get some fresh air. You need to go out, to the office. If you go by bus, you go by car, you go by, walking or whatever.
Get out of the house.
You get some exercise.
Yes.
You get, that is also de-stress. It's a stress buster. You go outside of your home, it's a stress buster.
True.
If you are inside your house and locked in a room and you are doing some laptop work, obviously, you'll be stressed like anything.
My God. So simple, right in
So,
front of us, we don't
so
take it
we
seriously.
cannot blame everything on COVID or COVID vaccine.
Mhm.
It has COVID has because of after COVID, there is a lifestyle change. After COVID, if you see, there is a lifestyle change in the kids also.
Okay.
The kids earlier they used to be studying in the school. Now most kids have a tab or they have a laptop.
Yes.
They are studying
Online
like that.
classes.
Online classes are there. Earlier there was no online class. So obviously there the kid, that is he. I mean he or she, the boy or girl going to the school and they are having some exercise. They are running
The
around.
mind is distracted in good
No,
stuff.
they are running around. They are running
Yeah.
on the school corridor. They are running in the field. But
Yes.
now they are
Yes.
confined to their room. They are confined to the laptop and doing some studying there. Obviously, it is going to affect in the long run. It is going to affect their heart.
Yes. True. True.
So it's not about it's not about COVID or post COVID or vaccine or anything like that. It's our lifestyle has become sedentary. After you just look around.
People are
Just
not
look
focusing
around.
on the sedentary
People are
lifestyle. They're
not
focusing on
taking
COVID.
COVID. It's not
Ah.
COVID, man. It's our lifestyle has
Yeah.
become
Yeah.
like that.
Yes. 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 Yes.
It's a lifestyle disease. Heart disease is a lifestyle disease. It's not a you sit down and you take all junk food and blame it on COVID.
Yeah.
It's not done.
No. And then again, when we say exercise and doing something work, people usually take it as if like heavy workout, going to gym and
No. Exercise means it's not exercise means you go to the gym and you lift some weights.
because
Or
those guys
nothing
are
like
also having
that.
heart attack.
Those are muscle building exercises. Muscle building exercises, they can give you a good physique. They can burn more fat. I mean, so they can make you leaner. That's it. But what exercise you stress upon is cardio exercise. You do some brisk walking for some 30 to 45 minutes. That's also a good cardio exercise.
Okay.
I mean, that will strengthen your heart.
Mm-hmm.
That will strengthen your heart. Not a muscle building exercise. Muscle building exercise will not strengthen your heart. This cardio will strengthen your heart. This
Okay.
some brisk walking, or if you are walking or running on a treadmill, so that will increase your that is called as cardio. You are doing some other dance kind of activities or some cardio, proper cardio is like some jumping or some those kind of active exercises that will increase your heart health.
And there's another thing about the gym goers. There is the use of supplementary protein, the gym supplementary protein, and steroids.
Yeah,
What kind of effect does those things have?
steroids are absolutely harmful.
Completely.
Yes,
For the
they're
people who find
that's
reasons to
why,
put
see,
it.
that's why many these professional if you are competing in any professional events, they will test you for steroids and all. They'll test,
Okay.
you'll take urine samples and test for steroids because it's a banned thing. So steroids are absolutely known. Proteins, yes, you can take, but that you should always take with a proper guidance, because over enthusiastically if you take a lot of protein, obviously it will going to affect your kidneys.
Oh my God, yes. Okay.
They will build muscles, but they will affect your kidney. So it's a balance.
Proper
It's a
balance is what
It's
the
a
key.
balance. I mean, how your body physique is, how it should be, and how you are trying to do it.
Now, if you go back again to the lungs aspect, one thing that comes very much, very easily with the lungs here is smoking cigarettes.
Yeah.
For the people out there who say that smoking one cigarette is fine a day, is it? How
See,
bad is cigarette?
yes.
And how if cigarette is? Are we seeing cigarette in the right way when we say it is extremely bad?
first you tell me why you are telling this excuse. Smoking one is okay.
I heard this because I've heard this. Yes, yes.
So this excuse you are trying to find for yourself is because you know that it is bad.
Ah,
You
yes.
know, when you try to find an excuse, when you yourself know that it is bad, but still then I am doing it, and that's why I am trying to find an excuse for it.
So it means one cigarette is bad enough.
Any kind of any kind of smoking is bad.
Any kind of smoking,
Yes.
not only cigarette.
It causes permanent damage to your lungs.
But-
It stays inside your lungs permanently.
Okay.
It cannot come out.
And the people who say that if you leave smoking for some months, lungs will go normal.
Never. It will never like that. Every day we open lungs and
My
we
God.
see it. It's black inside. So it's rare to find a pink lungs these days.
My God.
It's because pollution and all.
That's also good. But it's given.
But if you find a smoker lungs, it is obvious. Whenever we open open the chest, it's obvious that person is a smoker, because the lungs will be studded with black, smoke,
Tar, I guess.
Tar.
That's for tar, right?
the
Yeah.
black thing.
The black thing. So smokers who think that one cigarette is enough a day or 2 days, one cigarette is enough to kill you. That's true.
You cannot say that one will kill you. It's not like that. There are multiple factors. Multiple factors are there. Suppose one person is diabetic and he smokes. It is much more dangerous than a person who is non-diabetic.
Okay.
Usually, heart diseases, they are not caused by a single, they are not caused by a single factor. There are multiple factors are available. Multiple factors are responsible. Like suppose a person is having high cholesterol, and along with that the person is smoking. Obviously, he is going to have a heart attack sooner or later. Suppose a person is highly diabetic and he is smoking. Obviously, he is going to have heart attack sooner or later.
My God.
And suppose any two, if it is there, obviously there will be heart disease. So you cannot say that it's always the risk factors are multiple risk factors are there.
Now, this is what the smokers need to remember. First, get yourselves checked, and please, no smoking.
Yeah.
Always. At any given point of time, no smoking. And now, we'll go back to the checkup aspect of our conversation. This question might come out of the blue, but there is a thing that goes around that some doctors actually scare their patients. They might not be that bad in health, but they scare them so that they can mint out of them. How true is this? When they say the doctors are being, like when people start pointing at doctors, because I am fine, it's just doctor is saying so they can mint from me. Is there any truth to that?
See, many times, it's our mindset that we try to negate the fact. Many times.
The reality.
Many times we try to negate the reality. We don't want to accept it. I just cannot have some disease. That's it. Because, I'm running well, I'm doing this, I'm doing that, so I cannot have disease. I'm a pure vegetarian. I don't smoke. I don't do any wrong things. I don't have any bad habits and all. So I cannot have a disease.
The doctor is lying.
No, doctor is lying. Doctor wants to mint money from me.
Yeah.
See, every doctor always wants to focus on your health, so that you get your diagnosis in proper time. And most of the, obviously I cannot comment on everyone, but most doctors, they try to diagnose your disease. Obviously, there is some problem, that's why you have come to the doctor. So they try to diagnose your thing, and they try to give whatever possible, treatment available. They try to do it. If sometimes it is not in their hand, they can refer you to a higher center that is equipped with all the facilities. So it's not that someone is scaring you. It's not like that. Yes, sometimes we have to tell people that your disease is something serious, so you must take care properly. That may appear scary sometimes.
Yeah,
but that is never our intention.
It's something we need to keep in our mind, that doctors are there to help you, not to scare you actually. Now, if we go back to the aspect of heart health, complete core heart health. So, what are the tips you will give people that these are something that basic things they can do to make sure their heart is good?
Yeah.
Something very simple thing, like one or two you already said, maintaining a proper diet and this.
The first thing is that you reduce sugar and salt. Sugar
Salt
is the killer.
Processed sugar, I guess.
Sugar, all kind of sugar is the killer.
All kind of sugar?
Killer.
Oh my
Sugar is
God.
the killer. So you take any kind of soft drinks, there is a whole lot of sugar in that.
Yeah.
You just check the level, how much sugar is there. I mean, maybe some bottles of these soft drinks, they may be having 5 to 6 spoons of sugar. But you still think that I am not taking any kind of sugar. But how come I get some heart disease? Is because that is hidden inside. So that is one thing. Second thing, all kind of processed foods, these all packaged items. They, most of them are laden with, refined flour and this refined sugar, plus some weird kind of oils. We don't know what is it. So
If a doctor is saying we don't know what is it, you have to be aware completely out
no
of
one
that.
knows what is it.
See, that's the scary stuff. No processed foods.
So that is, you take your water bottle from your home, drink it, no problem. But don't, absolutely no to all those kind of soft drinks. They are laden with sugar. Stop, this excess amount of, this tea, coffee in your workplace. You take some 4, 5 or 6 cups of coffee in your workplace. You use it as a stress buster. But unknowingly you are taking that much amount of sugar. That many, that many spoons of sugar. So avoid sugar first. Second is avoid salt.
Salt.
Reduce. Whatever thing you whatever packaged items, chips, be it chips or whatever, is loaded with salt.
Yeah.
It is loaded, absolutely loaded with salt. So that salt is going to cause high blood pressure, and obviously it is going to affect your
What
heart
about the
rate.
iodine content?
Iodine, where is iodine? Iodine, it is in the, that
People
dietary
market it
salt.
that way. That's a marketing process, right?
No.
So what we do about iodine?
See, that is a noble purpose of the government to reduce iodine deficiency in children.
Yeah.
Okay, so in children and pregnant women, because at one point of time in India, goiter was rampant. So for that, to reduce that iodine deficiency, government introduced how to feed this iodine to common man. How to feed them
Through salt.
through salt, so that it is a cheaper alternative and you can use salt. Everyone uses salt.
Even will use salt for any
Everyone
reason.
is, but what I'm telling is that we are taking excess salt.
Too much of anything is bad.
Too much of salt. So that is one thing. Third thing is that check your oil. What oil you are taking?
Yeah.
Lot of nonsense oils are there. Lot of. I mean, you never know from where those oils come.
Palm oils and those kind of things.
So all those kind of things are there. You stick to your basic oils. You stick to your own, our traditional oils. Those are good enough.
Mustard and all.
Yes. Mustard, coconut, ghee, they are good enough.
Ghee is good.
Yes. It's not bad at all. The proper ghee is good for your health.
People say that you have ghee and you will have like this and that.
No, nothing happens. You take adulterated thing, you are going to die. You don't take adulterated things. So our basic traditional oils and ghee, they are all good. They are not bad at all.
Please, can you tell something more about the ghee aspect?
See, many times it is, many times it is, in researches also, it is seen that if you are taking if you are taking 2 chapatis,
Okay.
2 rotis, if you are taking plain,
Plain.
and if you are taking 2 rotis with little bit of ghee.
Yeah. Little bit of ghee.
Yes. Say 1 spoon.
1 spoon. Okay.
Or ghee on that, your sugar spike will be lesser.
Seriously?
Yes, your sugar spike will be lesser, because that healthy fat you are taking with that will reduce the sugar, immediate release of sugar into your bloodstream. That's why the sugar spike is lesser.
Mind blown.
So everything in moderation is good. There's oils and fat. But if you take some absurd kind of oil, obviously you are not going to have a good health.
We don't even know
So
the source.
all the kind of fast foods, they are using this, some abnormal kind of oil they are using, and so my suggestion is that stay away from those things. So these three things. Fourth, increase some, fiber content, your green veggies and all in your diet. And next is that already we have discussed to stop smoking,
Yes.
alcohol, smoking. Those two things, they are going to harm you. So stop, if not possible, reduce to the lowest, how much you can. So basically, I'll say stop it.
Stopping is the best one.
Yes, and the last one is do some exercise. Don't sit idle ever. So roam around, move around, meet people, work around. So that is good only.
Yeah.
Plus, get yourself tested at least once in a year. So that you can know if there is some problem is going to happen. You know it beforehand. So these things, that's it. Simple.
These are simple way you can just get it done.
Simple. These are simplest things.
And this won't even charge you any money.
It is free.
It's free. Out there.
Yes, it is free and it will also reduce your expenses.
Yes. Seriously. Now, if I give you an option to choose between one, I'll just give you two options. You take the question ahead. Running or walking?
See, running obviously will reduce it will burn more, more
Calories.
More calories.
Yeah.
But everyone cannot run. Everyone cannot run. Children can run, young adults can run. But the people we are talking, our focus age group, that is 45 to 50, 40 to 50, those age group, obviously they cannot run in a proper way. So I will suggest a brisk walking is the best description.
For how long?
Brisk walking, 30 to 45 minutes. 45 minutes.
Constant walking though.
Constant walking. 45 minutes minimum in a day is the best thing you can do to your heart. Obviously, later on you can do all kind of exercise. If you are doing it, it's only better. But minimum is this. Brisk walking.
Again free.
45 minutes. It's absolutely free. You get free air, you get free sunlight, you get everything free.
Everything free. And your heart will become...
you don't need to go to a gym subscription and all. That is nothing required. You absolutely free. You roam around in the roads and that's it. And you burn calories and keep yourself healthy.
Gym is more for the muscles gain.
See,
but this is more for proper
gym,
health.
Yes, gym. If you are doing some focused workout, you don't have a proper place to do this walking, jogging and all. Then you go to the gym, you go work on the treadmill and all, because it's a closed space. It's good only. I'm not telling it's bad. It's good only, but it takes money.
That's true. That's true. Now, there's a very personal question coming from, whenever we say that you're eating junk foods and these and those, eat homemade food. Homemade food is always good. So is there any specific local cuisine that we think is very healthy because we have made it in our home, but it's actually not good for your heart? Is there anything like that?
See, whatever you cook in your home, obviously you take the best ingredients.
Yeah.
You try to cook it with the best, healthiest oil. It is healthiest. So these are all good only. No food is bad. Yeah. Food is not bad at all. Every food is good, but adulterated food is bad. Okay. This junk food is not at all bad also. Many countries, this what we call junk food is, suppose we take the example of noodles.
Yeah.
Many countries, they are staple diet.
Yes, and they're perfectly fine.
They're perfectly fine.
Yes.
So we cannot say that it's bad. Only when it gets adulterated by some adulterated oil, some other some colors and all, then only it gets bad.
Okay.
So no food is bad. You cannot say food is created by God. It's not bad.
Very nicely said. Very nicely said. Food is created by God. It's adulteration that is messing up everything.
That's adulteration. Yeah. That is bad.
That is a relief for me actually, because I'm a big foodie. And every time we eat with the guilt, like, I like this dish. Yes. Do I have to give it up? No. The answer is no.
It's not at all. Not at all. Not at all.
Lovely.
You can take anything unless and until it is not adulterated.
Okay. Now, I'm going to talk about some myths. Okay. So there is a myth that cholesterol is bad. Is cholesterol really bad?
See, cholesterol means lot of food is having cholesterol.
Yeah.
Cholesterol is not, as such, is not bad. As such, it is not bad. You can take any amount of cholesterol, your body will metabolize it. Okay. Sometimes there is a, there is a problem with the metabolism of this cholesterol. Sometimes. So, suppose you are a healthy person, you don't have any diseases, you take cholesterol rich food like, like red meat, like egg, that yellow part of
Yolk.
the egg yolk, you take, and absolutely perfectly you can metabolize it, your body will metabolize it. But sometimes there are some diseases are there when there is a problem with the metabolism of these foods. Then only the problem rises. Then only your blood cholesterol level increases, and we blame it on cholesterol.
Yeah.
So technically it is not bad. Our metabolism was somehow deranged. That's why our body could not metabolize it. That's why it increased and it causes some problem or something. So as such, it is not bad.
And there is a
So that's why you
correctability-
can say that all cholesterol is not bad. Cholesterol is very good for your brain. Many times
Yeah.
if you don't take cholesterol properly, then your brain function will be reduced. Maybe
the good
reduced.
cholesterols.
Good cholesterol. All cholesterols are good only. Whatever
All are
is
good.
made is made by God is good only. It's good for your health. It's good for your health. But if you indulge in it, it gets bad.
The balance need to be
If you ruin it by your greed, then it's bad.
there. Okay.
So cholesterol is good for your brain. If you don't take proper amount of cholesterol, you may be having, in elderly age group, you will be having cerebral atrophy.
Like
The
dementia, those
shrinkage
kind
of the brain and all. Brain function will be reduced.
Okay.
So cholesterol is good only. When only our body is not able to metabolize it, or you take excess of it, obviously it's going to happen.
Yeah, true. Another thing that I'm trying to say over here is like we have already established the fact that smoking cigarette and alcohol is bad. Now there are people who say that a small peg before sleep good for your heart health. How true is that?
See, these are all excuses by these people. So if you want to take it, take it. Don't make an excuse out of it that I take this, I take that. So if you want to take it, take it. Once in a while, someone is taking, take it.
But
Okay.
that will also affect in a bad way, right?
Yes, it is always said that any amount of alcohol is bad. It is written in the book. Any amount of alcohol is bad for your health.
Even wine.
Any
alcohol,
it's an alcohol
any
only.
alcohol,
Any
yeah.
alcohol is bad. But it's there is a saying that wine in moderation is good.
Yes.
I don't know how they get that fact. I mean, it's not. I don't think it is proven by any research or anything like that.
Medical science is not proving this.
How can you prove it?
Yeah.
You cannot prove it. There is no proof.
My God. Now, there's another thing people say that you can, as long as you're talking about busting myths, without any doctor's help, you can completely reverse your heart health with lifestyle change. Is it possible?
Kind of. You can you can change it. You balance your sleep cycle. You balance your diet. I mean, proper diet, and avoid any kind of refined or packaged items. Avoid most of the dairy products, particularly. Sometimes some dairy products they can also cause inflammation in body. That's why many people are going vegan these days.
Yes.
So because pure milk is good only, it's not bad. But this you don't know where this milk is coming from.
Yeah.
You don't know it.
We get from a packet.
You get it
That's
from the packet.
Packet, a specific brand
So
is
you
there.
don't
That's
know
it.
what is it.
Exactly.
So that's why many people are going vegan also. So with those kind of things, you can reverse to some extent. To some extent, you can reverse it.
And finally, I would like to know something like focusing on the younger generation, which our concern was from the beginning. That what is a 25-year-old's concern should be about their heart? What they should think about their heart You gave a lot of points though. If you could summarize those points, and what is something they should completely like avoid? They should be like one myth they think that they are good at, but it's not.
Yeah. See, to a 25-year-old, I mean, my suggestion is that never think that, whatever you do, nothing will happen to you because you are young. Nothing can happen to you because you are young. So that is a myth. That is the biggest myth. Nothing
Biggest
can happen
myth.
to you because you are young.
My God.
Nothing like that. In the long run, if you continue smoke, if you continue to drink, everything is going to affect you. Everything is going to affect your body. You may have diabetes, you may have hypertension, and so many things are there. So my suggestion is that to a 25-year-old, as far as possible, avoid sugars, these kind of refined sugars, avoid that. Avoid smoking, salt, sugar, salt, smoking, avoid those things. And alcohol, obviously. Indulge in a healthy lifestyle. Healthy lifestyle means, I'm not telling that you wake up in 4 a.m. or something like that. You wake up in a proper time, you get a good night's sleep. Don't don't stay awake all night to do some work or something. That work is not going to help you in the long run. So there is no point. No point. You work somewhere that is, stay awake all night, no point. So, all that we have discussed, stick to that, stick to the basics.
Stick to the basics.
Stick to the basics. You avoid, the obvious, avoid the obvious. Avoid the obvious means avoid salt, avoid sugar, smoking, alcohol,
drinking.
all those things. Plus, stick to a healthy diet, proper diet. Homely food is good. If not possible, basic diet, that is good.
Be conscious about what you're eating.
Yes, be conscious of what you are eating. And because most of the things are adulterated, stay away from that. That adulteration, that is bad. And do some exercise, stay stress free. That is the best thing you can gift to your body. So you stay away from stress, and that's the best gift you can give to your body, is staying away from stress. Stress can cause inflammation inside your body, and it can cause all kind of diseases. That inflammatory response in your body can cause all kind of diseases. So these are the things. That's it.
That's it.
So
as simple as
so simple and so inexpensive.
So inexpressive. See, my friends, through in this conversation, it's what Dr. Biswajeet Mohapatra was trying to say over here, is that don't let your fear cloud your or shroud your judgment on having a proper lifestyle. A proper lifestyle is still right in front of you. You can do it. And so thank you. It is lovely having you. And the kind of information that you have given. And for my take would be the fact that ghee is not bad. In right moderation, ghee is good. So these are certain things we didn't knew about. Even I didn't knew about. And something today we all came to know. So for these kind of facts, for these kind of conversations, stay tuned to OrissaPOST Live. I am Saurav Sanyal.